Happy September, everyone. Welcome back to the Carsey Policy Hour. You are joining the Carsey School of Public Policy's monthly discussion series for people who are passionate about the issues and policies that shape Granite State communities. Boy, do we have an exciting fall for you, leading into and after the November elections. Civic health, food and agricultural policy, actionable demographic analyses, energy policy, and more. My name is UC Terrell. Most days I serve as training director for Carsey's Center for Impact Finance, focusing on equity and climate investing. But it's a treat for me to work with our new Carsey director, Stephen Bird, to bring the smorgasbord of New Hampshire issues and collaborative problem solving to the folks who are rolling up their sleeves to make our state better. As you enter today, please type your name and organization in the chat so we know who's here today. As always, your questions and comments are welcome in the chat. I'll include as many as I can in the discussion, and we'll also follow up with the recording and slides. Thanks, as always, to our partners at New Hampshire's Bureau of Education and Training. The BET's Certified Public Manager program feeds into the Carsey School's master's programs in public administration, public policy, community development, and global conflict and human security. And also to our partners at the New Hampshire Municipal Association. NHMA works to strengthen New Hampshire cities and towns and promotes effective municipal governance through education, training, advocacy, and legal services. And I encourage you to check out their conference in late October in Manchester. We are starting this Carsey Policy Hour year with a bang, hosting Carsey's own Jess Carson and Evan England from Carsey's Center for Social Policy in Practice. The center, under Jess's leadership, has worked for many years in the field of early care and education, or ECE, collaborating with many of you in applied research and program development. Today marks an exciting milestone in New Hampshire's ECE landscape, the launch of the New Hampshire ECE Research Consortium, which Jess and Evan will tell you more about. Jess, I'm going to turn it over to you for an intro and more on your latest ECE work. And again, I encourage audience members to put questions and comments in the chat. We'll have a lively Q&A and discussion following the presentation.
So thank you for that nice introduction. I'm Jess Carson, as UC said, and I know many of the folks in the room today. So hi to all those friends and collaborators and colleagues who've joined, and thank you very much for taking the time. So Evan and I are going to share a little bit about our most recent work around ECE, and in particular, I'm going to share a little bit around the data front, kind of catching you up to the latest that we know in our data pieces, and then I'm going to transition to Evan, who's going to share a little bit about how we're putting these pieces together in a way that lets us work with all of you in a consortium model. So for my part, I'd like to talk a little bit about recapping some of the biggest ongoing challenges in the state's ECE sector, and then a little bit about how the data and research infrastructure can help support some of the solution building around those challenges before Evan takes over and tells us a little bit about the consortium in particular. So this will not be news to many of the folks who are in the room, but just as a place to kind of recap and level set together, some of the key challenges can be actually summed up rather easily, even though the issues are pretty complex. So first, families pay way too much to access early care and education. Most New Hampshire households with a child under age 5 use childcare. They use it so that they can go to work, so that their children can access early learning opportunities. And when we say most, we're talking upward of 70% of those households. The challenge is that childcare isn't funded as a public good like a K through 12 school is. So the cost of that care falls directly on families themselves. And we've seen costs in recent years continue to escalate until the 2023 costs really hit the highest point they've been at almost $32,000 a year for a New Hampshire family with an infant and a 4-year-old child. So that expense, of course, is substantial for any household, but particularly households with children who tend to be younger themselves, perhaps earlier in their careers, and not as high earning as some of the other populations that we have as our state population. Even though families pay so much, the flip side of the coin is that providers earn too little. So when we have the cost of tuition falling solely on families, And in order to provide the level and type of care that kids need at that age, we need really intensive staffing models. So we need to be able to ensure we have adequate numbers of child care professionals who are there to care for the littlest kiddos. When we do that, it means that we're spreading these family tuition costs across multiple workers. And so when we spread that tuition dollar across, it doesn't result in anywhere close to a money-making scheme for most childcare providers. And in fact, the average annual salary for a childcare provider in New Hampshire, a worker, was $32,000 in 2023. As a result, we have several challenges that are sort of unfolding and have continued to unfold, and these are not new, but we can sum them up as: one, our already inadequate childcare supply is shrinking, and we can continue to monitor that. We have continued to monitor that over time, and Carsey's been looking at these licensing numbers in particular for many years, and we can see that those shifts are unfolding in real time. We have fewer providers. We have providers who are more geographically consolidated because the smaller providers are just less able to stay afloat as a business model. We also see that childcare costs are high and they're rising for several reasons. So one is because the cost of doing anything is up. So the cost of rent, the cost of materials, the cost of supplies, anything is all up. But also we've seen some need to push wages up in order to retain a workforce there. And then finally, one of the challenges for families is that childcare often can't offer the flexibility that families need. So people often lament the need, for example, greater evening or weekend care, longer hours, different hours, more flexible options, greater offerings, and the challenges that providers are not able to offer those sorts of things, often because they can't staff that sort of level of ongoing, all hours around the clock care. So where does this leave us? Well, we've seen some really exciting legislative action in the last year or so in New Hampshire. Places that seemed like a dream a couple of years ago have started to unfold some real policy movements. So effective in 2025, for example, there's an expanded scholarship eligibility for childcare professionals. So if we think back to my slide on wages for childcare workers, and we think back to the slide before that around the cost of childcare, if a childcare worker also needs care themselves for their own children, that could consume nearly their entire wage to be able to pay for that care. So that's just not sustainable. So one of the policy solutions that we're seeing emerge is being able to expand eligibility for supports for those professionals as a way of retaining that workforce. We also see in place now expanded scholarship eligibility for families. So higher income families are now eligible to participate in our state child care scholarship program. We see that the lowest income families are expected to contribute less now than they were even a year ago to that care when they're using a scholarship. And we also see the value of those scholarships in form of reimbursement rates to providers has gone up, which makes it more feasible for providers to be able to accept families who are using childcare scholarships. So that really opens up options for families, particularly families who are lowest income and relying on childcare scholarships in order to access early care and education. However, despite these really exciting policy shifts, our ability to track and monitor the changes that might be triggered by those policy expansions is early. So data infrastructure has not historically been a critical investment for New Hampshire in general. And I mean, that's not a surprise to anybody who knows anything about New Hampshire, has been here for any length of time, is that we are a small government state, that things like a big sort of state government infrastructure, including data, are not typically the kinds of things we invest in. But that means it makes it harder to be able to tell whether the things that we are investing in are working. And this started to sort of present a real challenge during COVID because we were not as well equipped to be able to track those types of investments, where those dollars went and how they worked during COVID. And it really has foreshadowed a little bit our ability to measure these kind of subsequent policy impacts. So ever the optimist, I guess, we say it's a good time to strengthen our collective research infrastructure then. It's a good time to be thinking about data and research and how do we bolster that so that we are able to understand what that should look like. So this brings us to sort of our kind of key thinking around the challenge that has set up our sort of push towards a consortium model. So what is the status of our state's research and data infrastructure? We have a lot of really cool, smart research happening in the state. Historically, multiple institutions have been working on ECE research. Here is just a set of some of those folks, including lots of folks that we love working with. And the work has typically been produced in its own spheres without working together intentionally. And that's often because it's grant funded or it's meant to answer a specific challenge, but it's sort of pockets of research happening that are really great, but not necessarily knitted together intentionally. On the data user side, we see lots of folks who really need data to be able to make decisions on the ground, but they don't have a specific source to find those data points and that information. So that includes our friends at the state, our friends on the ground, and our folks who are working in the policy spheres. So we're positing that we really need an infrastructure to be able to coordinate those efforts to make sure we're not duplicating, that our scarce resources are working together to push forward in really intentional ways and to grow that capacity as a state. And so for research institutions, that means being able to quickly answer, did somebody already answer this question? Or what's already done on this topic? What important questions aren't being studied by anybody yet? And then what could we share to be able to go further together? On the stakeholder side, that means, where do I find an answer that I need at my fingertips for writing a grant application or for, writing something for the press or tracking a policy? Who do I ask for tech assistance? What works so far? And then really all coming together around, well, what is the policy agenda that we should be working for? How can we inform that long-term vision? What are the things that we know, the things that we need to know, and the things that we want to keep track of?
Thank you, Jess, and thank you, UC, for having me here. So there is a need to establish a data infrastructure for ECE in the state, as Jess mentioned. And so in response to that, in late 2023, just last year, the Couch Family Foundation funded the Carsey School to do just that, to stand up a statewide ECE research consortium. And there are kind of a number of approaches that we've been taking to kick off the consortium. There are some initial activities that have been very important. So identifying and synthesizing and disseminating existing research, which will naturally lead to addressing some immediate research gaps that we might find are missing in the current research that's out there. Creating and refining an infrastructure for disseminating the research. So making sure that we have really good, easy ways to share the data and the findings that we do have, and setting a research agenda collaboratively. So using all of those methods, working together with partners to make sure that we are developing a research agenda that really is meaningful for the state and that is reflexive to the research gaps that we find and to other needs that come up. And then, of course, growing and scaling the collaboration and the capacity to support the state more fully. And I think it's important to note here that this is a collaborative process. So this is not work that has been done solely by Carsey. This is in conversation with the Couch Family Foundation, with the New Hampshire Fiscal Policy Institute, and with other stakeholders in the field as well. And that's the type of collaboration that we hope will continue. And over the next few slides, there will be some screenshots with some small print. So just a disclaimer, I don't expect you to read everything on the slides right now, but they will be examples of things that you will be able to find on the new website. So it is www.nhece.org, housed within the Center for Social Policy and Practice web pages. And this is the landing page. So it describes a little bit about who we are and what we do, a lot of the things that we've been discussing today. And then here's a list, some bullet points that describe the types of resources that we hope to provide through the website. So maybe first and foremost, we'd like, as Jess mentioned, we'd like to be able to make data available to data users who need it for a variety of reasons. And so we're working to build this centralized location through the website for easy data access. We hope to do that through a data dashboard that has some key data points for really easy access for you to be able to come in, find what you need very quickly without having to search for that yourself. Another really primary resource within the web pages will be research publications. So there will be a wide variety of research products that are coming out through the consortium and through partners. And we want to have that in a really nice centralized location for you. So kind of the first launch of a series is going to be the Granite Guide to Early Childhood. And those are a series of primers, which I'll actually discuss a little bit more in the next slide. That will be really exciting, and they're being launched now. There will be additional publications that are related to ECE that will be created and disseminated both by Carsey and from other New Hampshire ECE partners. And then also we'd like to provide some opportunities to collaborate on research publications. So if that's something that any of you or anyone else out in the field has an interest in being a part of, we absolutely recommend that you contact us. There's a contact us web form on the website, and you can also reach out to Jess or I directly as well. And then the other piece of resources that's pretty separate from publications, but not necessarily mutually exclusive, are stakeholder connections. So as a consortium, we really want this to be a collaborative effort. It's not about Carsey alone. It's not about any group alone. So we want to find ways through the webpage and through other methods to bring stakeholders together, to build connections between researchers and research users, to contribute and shape the ongoing ECE agenda. So here is an infographic that we developed to describe the Granite Guide to Early Childhood. So as I said, it's a new series of primers, and they're intended to be kind of a robust but succinct way to describe the ECE landscape in New Hampshire. And so there are 7 primers. The first is already available on the website. It's titled, "What Do New Hampshire Families Want for Childcare?" And it's a 2-page succinct way to describe what is the demand for ECE in New Hampshire from families' perspectives. The next primer looks at supply. What is the childcare landscape? So after kind of considering what the demand is, what actually is the supply? And then we work through some other topics like workforce, costs to families, costs to providers. What does the New Hampshire Child Care Scholarship Program look like? And finally, we'll end with looking at some equitable systems of childcare, some promising models for the future. And it is our intention that these are living documents, that they'll be updated at least annually, so that actually they will be products that will remain useful over time as well. And this is an example of a stakeholder map. So this is kind of how we're hoping to begin to connect partners in a way that is actually a resource to the field. This actually started as kind of an internal project for a way for Jess and I and our team to wrap our heads around who is actually out there doing this work in New Hampshire. And we quickly realized that this was a resource that would actually be useful for everyone, understanding actually who's out there, who are the organizations and individuals doing work. So this is the example of the community stakeholders map. And it really branches out to describe all of those organizations that are community-based. They're advocates, they're conveners who are doing really great work to support ECE in New Hampshire. And I know that this is small print. You will be able to find this on the website to enlarge, to print out, to use for any of your purposes, to reach out to other partners, to connect with folks that maybe you didn't even know were working in the field that are working on specific areas. And I'll point out that this is just the community stakeholders map. You'll be able to find other maps coming soon on the website related to research and evaluation, funders, state agencies, and possibly more. We absolutely recommend that you reach out to us if you find that anything on the map is not quite accurate or if there's something missing. This is meant to be a living document that is informed by you as well. And now I'll just give you a little bit more detail to kind of explain what a potential partnership could look like within the consortium. So as I mentioned earlier, New Hampshire Fiscal Policy Institute has been greatly involved in childcare New Hampshire, and Carsey has partnered with them to develop this initial 18-month ECE research agenda, which includes a shared framework, shared goals, and a coordinated timeline. And so these are just a few examples of activities that have happened or are in process through this year that describe kind of how New Hampshire Fiscal Policy Institute and Carsey have collaborated together to launch products that will be useful in a very coordinated way. And of course, there are some more products that are in process as well, but to keep it brief there, here's just a few. Okay, and that brings us to our final slide, references and resources. And Jess, feel free to jump in with me. It's our contact information. The website's listed here. The QR code also links to the website if that's easier for you. There's the NH website. As I've said, they've been integral to this process. Please reach out to them as well for resources. We have their recent video explainer on childcare listed here, which is an excellent visual brief resource to describe childcare in New Hampshire that I recommend to anyone who's interested in understanding more about the field. And also the New Hampshire Preschool Development Grant. That's been an essential component of this process as well. And you can find more here. Oh, and I can't stop before saying there is an upcoming presentation on October 2nd. Jess Carson is a part of that conversation with the Rochester Child Care Center. And I believe it is being hosted at Frisbee Memorial Hospital. So please feel free to register for that as well.
Thank you, Evan. And you say if it's all right, I just want to add thanks to our partners at the PDG who've been an integral part in helping launch the Granite Guide series. The support from the PDG has been amazing, both in terms of helping to fund the first couple of initiatives, but also just the thought partnership there has been incredible. Similarly, thanks to NH who've been amazing partners throughout the process of really figuring out how to work together and what that looks like. And also just, we've mentioned it in the slides, but just really want to acknowledge the role of the Couch Family Foundation, who's been an incredible long-term partner of the Carsey School. And we really could not be doing anything close to this scale without that partnership.
Thank you so much, Jess and Evan. I see questions and comments are starting to come into the chat, and I certainly have some on my list, but would love more so that this discussion can really be informed by the field and those of you who are doing the work. Just to be very clear, in a practical sense, what does it look like to get involved in the consortium?
Yeah, thank you. I think I'll jump in, Jess. I think that there are a lot of different ways to do that. And we're really hoping that the consortium can be accessible to not only researchers, but also people who rely upon research and who use data. And I feel like that's probably a lot of people in the ECE field, right? So as I said, there could be opportunities to collaborate on publications. If you have ideas about possible topic areas that you might be interested in working on, that maybe hasn't already been covered through other ECE publications, please reach out to us and we'll find whether that's collaborating with Carsey or maybe other partners within the consortium. We can help facilitate that. And also there are lots of ways that you'll be able to access data products, those stakeholder maps. Those can be ways that you can find other folks in the field that you might be interested in connecting with that maybe you hadn't already considered.
That's fantastic. We focus on New Hampshire. To what degree will this research be informed by emerging best practices in other states? This is a question in the chat. And are there other policy initiatives out there that seem to be successful on impact and on cost?
I can take that one. Yeah, it's a great question. So I think the core of our mission is to really understand and support the research base around New Hampshire, but it would be silly to not draw on lessons learned in other places, and in particular because there was a lot of natural experimentation around the time of COVID where states really had some flexibility to make investments that they might not normally be able to do, and other states have been able to sort of test some of those mechanisms in a way that opens up a lot of opportunity for learning. And so really drawing on what those other models might look like, where are some of the areas that New Hampshire might want to think about, how those lessons learned could sort of apply to New Hampshire, I think it would be a really integral part of any of the real policy conversations moving forward.
Are there any that jump out at you as particularly inspiring?
Yeah, I think there's a lot of interesting effort around sort of recruitment and retention of the workforce, and some of that's even happening here in New Hampshire. We're seeing smaller kind of pockets of the state testing out models with either philanthropic support or other kinds of bolstering supports to really test what does it take to be able to really attract really experienced savvy education professionals and to keep them in a way that really lets them see ECE as a viable career path. And so those are some of the most exciting pieces, because workforce really is one of the issues that I think is really important for us to tackle as a state.
We got a sense of some of the areas that you saw as gaps in research, you and your collaborators. And I'm wondering if you could elaborate on those, or where you think the most interesting ones are. I will note that Sarah in the chat would love to see more data focusing on the well-being of children in care. Families have been struggling with expulsions and dealing with children's behaviors and unable to find care that can meet their child's needs.
That's such a good question, Sarah, and such a good point. I mean, that's a perfect example of a gap. We don't have a really well-established evidence base on that topic in particular, but it's a real question, and the question around how those needs have changed over time and what the options look like for families over time. I think that those are real question marks for us as a state. I think Sarah's question points to another opportunity as well, which is that's maybe not necessarily a body of expertise that Evan and I have specifically, but the point of the consortium is that we don't have to be the ones that know all of the answers and have all of the topics of expertise covered. Really, it's a structure for inviting other folks in who maybe do have other areas of expertise that can be really complementary. The consortium can help sort of pull them in and give them a structure for collaborating with the Carsey School and other researchers who are doing ECE work. So Sarah, if you have thoughts on ways to measure and to think about that, we would absolutely love to have a conversation about that.
Absolutely. When I think of the research, there's the data, they're setting the measures, that's the data collection, analysis, presentation. Sometimes we do research basically knowing what the findings will be, but just, from a practical sense, but just needing to be compiled or quantified or presented in a way to decision makers that can move the needle. And sometimes we're genuinely in the dark what the data will tell us. And I wonder, of the broad topics you've thought of so far, are there any that fall very clearly in one or the other camp?
There are. I mean, I think maybe one of the ones that feels a little bit like it was filled with fewer surprises might be the work we did on our first primer around what do New Hampshire families want and what does that demand side look like. And really, I think anybody who is a parent or knows a parent or has a family or has met a child or, all of us want a place to put our kiddos during the day that feels safe, that we feel like they're taken good care of, where we have choices between what's the right option for our family, for our child, and our child's special needs or circumstances, that we can afford, that we can open the hours that we need it to be. All of those pieces that are really important for any family just in everyday life, those really sort of pan out in the data that families do say they prioritize things like reliability and flexibility and choice, and those things are very much sort of not surprising, but rather kind of instinctual, and were confirmed in that research. And places that were a little bit more in the dark are maybe around some of our specific policy mechanisms around sort of the reach of those so far and what that looks like. And I would say as a state we are trying really hard to figure out ways to capture some of that and to really seize the moment around these exciting policy initiatives and to make best use of the data that we have so that we can really understand what some of those lessons look like.
Thank you. Looking at the attendees, and if you haven't put your name and organization in the chat, please do. There is such a wealth of knowledge in this area, and I really do encourage folks to add to the chat for a conversation that's a little more, I guess, elevated than the generalist questions that I'll be asking. This is it's just, you've done so much work and so much needs to be done in this area. I'm going to ask a more, we didn't prep for this, Jess and Evan, but like many of you, I watched the presidential debate last night. Of course, New Hampshire had its primary elections with no incumbent governor. There's a huge difference between policy and politics, right? So we're not partisan, we're not getting involved in the politics, but I'm wondering if you could address broadly how the research consortium or the ECE landscape as a whole is is vulnerable or could be affected, by these sort of changing political tides versus what, like, a consortium that's simply gathering data might be more steady. Address since we're living in such vibrant times, how are you in the field thinking about what's going on politically?
Yeah, I mean, I think there are several layers to that question. So one is always sort of, we care a lot about what's happening in early care and education field. So what's happening to the folks on the ground, our colleagues on the ground, in terms of their ability to be able to offer the kind of care that they're trained to do, the ways that they reach and work with their families. All of those things are shaped by the policies that they operate within. So anytime there's any kind of policy shift that affects those families and those childcare providers, that ripples up to the things that matter for the research too. So I think that there's that side of it. There's also the piece that many of the folks who are doing ECE research are folks who are grant funded. And so the availability of funding to support scholarship can sometimes be shaped by the political winds, particularly with federal funding that is available. However, we have a pretty robust private philanthropic network as a state, and we're really lucky to have support from, for example, the Couch Family Foundation, which is a much more steadying support than sort of any one administration would be able to kind of have a hand in. So we're lucky to have that kind of even support. But I think when we think about the capacity for our networks to engage in the research and for the questions that we're tackling, both of those things are undeniably shaped by the political climate around us.
This is connected to so many other Carsey Policy Hours we've talked about, just around affordability, cost of living, access to sort of a stable life for young professionals and their families. We had last year around this time, Stay Work Play, talking about the state's efforts to retain young people, right? And so it's all woven into this fabric, and also thanks to the foundations that are stepping up in this area. Beverly has some great questions, and I'm saving your broader one for the later, but one that's more that's specific here is, are you including the levels of education at the child care givers and workers and the early childhood education that the children are getting?
That's absolutely a question of interest, right? To think about those pieces, both of the childcare workers' own education and also the quality of care that they are delivering. Those are certainly under the EC umbrella. And Evan, I don't know if you want to add to that, but I think that my answer would be yes, that's absolutely part of our purview.
Yeah, I would agree. I think that those are completely salient pieces of the workforce puzzle, and understanding differences in, equitable access to pay and what that means for the workforce. I think that's certainly a part of the conversation.
Linking back to questions about expulsion and behavior management, as a parent, I know that skill in behavior management doesn't necessarily correlate with level of education. And so, in terms of workforce training, academic, non-academic, what are the other skills that you're seeing the field recognize it needs in workforce training? And in particular, bringing in Chrissy's questions, are there efforts in the field to train educators in handling challenging behaviors?
Yeah, I would say that's certainly part of it. That's always been part of it for early care and education professionals, but maybe even more so since the pandemic. I mean, I think we're still feeling a lot of the ripple effects of kiddos being in tough circumstances, families being in tough circumstances, and being disconnected from many of the typical support mechanisms that they would normally have access to. So whether that's their schools and their counselors at school, or their regular healthcare appointments, or their peer networks, or their extended families, all of those things shape the world that kids live in. And so when pieces of those fall away, there are implications to that. So I think educators have been saying and continue to say that there are ongoing effects of the pandemic that are certainly part of that conversation. When we're thinking, higher level about sorry, I lost my train of thought thinking about thinking about the effects of the pandemic. But yeah, sorry, let's bring it back to the workforce piece and say that's not the only piece, of course, that educators are thinking about. And there are lots of things that we have long known are really important for educators to have in terms of skill sets that are maybe a little bit harder to sort of credential and measure, things like responsiveness and warmth with kids, consistency. Those things are certainly measurable. There are efforts to do that, but are ways of formalizing what that looks like and getting those levels just right in terms of, how do you make sure somebody has that skill set before they come into a classroom? It's hard to do. It's hard to do. And it's part of an ongoing conversation around quality, which somebody did mention in the chat around, George mentioned around the granite steps for quality and thinking about, what does that look like and how does that contain some of these pieces as well.
Yeah, and for folks who are just listening, George at the Behavioral Health Improvement Institute, or BHII, is involved in a current pilot with Granite Steps for Quality, specifically addressing how to support ECE sites to meet the needs of children and families referred typically suddenly by DCYF in connection with foster placements. And the purpose is to specifically, the purpose is to reduce expulsions and consequent failure of foster placement, compounding trauma for children and all of the compounding factors that, that come from that. I was thinking of mental health as well, which is integrally connected. And you mentioned COVID as a precipitator of some of these additional challenges or amplifier. And how is the ECE field formally or informally in discussion and structural alignment with the mental health structures here?
Yeah, I think they are inherently linked in that early educators understand that that is a salient piece of how their kids and the families that they work with operate in the world, that those pieces matter for what they see in the classroom every single day. In terms of how the sort of structural pieces out in our state work together, I think that we maybe have ways of pairing those sectors together, but there are probably ways that they could be strengthened as well. I mean, we certainly have a lot of expertise in the state around mental health, around youth mental health, and around infant and toddler mental health. And so finding ways to make sure that not only educators understand that, because I think they already do, but have the capacity to think about what that interchange looks like. I think it's a lot to expect an early care and education professional who's paid $32,000 a year to be able to solve every family's mental health crises, or meet their mental health needs or support their mental health well-being. But it's certainly a salient issue for things that they see in the day-to-day. So it's a little bit of a balance.
Right. We had a Carsey Policy Hour, you remember, last spring, looking at the unwinding of the of Medicaid coverage and its impact on community health centers. So for folks who are interested in that piece, I encourage you to go back to the recording. Joanne Malloy says, talking about the Institute on Disability at UNH, is working with the Association of Infant Mental Health to continue to expand the early childhood family mental health credentials. Right. And Beverly dropped the link in there too. I was going to ask this sort of broader question of, are there other areas related to education and public education that need more data infrastructure to support our students and the quality of their education? And that, that really could be even outside of education, right? You're pulling together this multi-stakeholder, data-driven research consortium, applied research consortium, and that as a model certainly could be applied in a variety of areas. So I wanted to put that to you now, but also put that to folks who are on the call. If there are other areas that you see in New Hampshire and beyond that would benefit from this type of research consortium, drop it in. We might do it at Carsey. We might know people who do it. But Jess, Evan?
I think, honestly, I think back to mental health. I think that there are a number of areas of interest that are intricately related to ECE and really can't be untangled from that field, but that do also have broader impacts in families and in communities that really kind of merit probably a more collaborative, I would say, more collaborative model of data sharing and data access. The kind of lack need for a greater data infrastructure that Jess mentioned earlier throughout the presentation, I think is not unique to ECE. I think that maybe there could be opportunities for a lot of research collaboration in other areas as well for the state.
And you see one example, I think, of ways that collaboration, even outside sort of the typical ECE sector, are evident is, for instance, we worked with the PDG team this year on collecting data around preschool in public schools in New Hampshire. That's typically not been an area where we have a really robust set of data. Our colleague Eileen Murphy, who I think is on the call with us, diligently contacted every public school in New Hampshire who had some record of serving children who were in preschool or kindergarten, and got information from those contacts around what the offerings look like, what age of children were served, under what sort of specifics, how many were served, and recorded that information so that we were able to create a sort of data set around what those public schools offer for preschool across the state. Now, that doesn't exist anywhere else, and has, there are questions when we look back at it, we think, oh, geez, we should have asked this or added that. But it is a start to sort of being able to ask those. The colleagues at the Department of Education here in New Hampshire were wonderful resources in really helping us understand what it was that we were looking at and how to interpret it and what it looks like from the school side. And it was a really nice chance to collaborate with a set of folks who were not necessarily typically early education people, certainly educators and in the education field, but a way to sort of connect that bridge of that work outside to another part of the state. And I think that type of model is a bit of an illustration of ways that we can continue to collaborate, both Carsey folks, but also other folks who are connected to the consortium with other parts of the state working in kind of related but not squarely ECE sectors.
Right. Yeah, just my other hat, our Center for Impact Finance is in our second year of our research consortium for community development finance. It's a field that, like early childhood, early care and education is can be fragmented. Like there's a lot of different smaller lenders in this case, and while guided by certain regulations, also have a leeway to meet the needs of their community, which makes measurement difficult. And by having a research consortium that gives small grants for larger institutions and academic institutions to do research, it's not only answering those specific questions, but it's also building the capacity of the field for research. So in our most recent rounds, we had more entries from or applications from academic institutions who are starting to realize that this is a fruitful field for research, in addition to the research that was led really by practitioners. So field development, absolutely. Donna is asking, how will you maintain the data that you have gained? It seems like you are cold calling to gain information. Will this be how you will be gathering data ongoing?
Donna, what a good question. Poor Eileen. I hope not forever. I hope that's not the only path forward. That's the right take, though. That is exactly what it was. We do not have an infrastructure for collecting these data another way. And so Eileen truly was cold emailing, cold calling all of these schools to get this information. In terms of sustainability, unless, Eileen lives sitting next to us and does that, over and over and over again, it's not a very sustainable infrastructure for collecting that information on an ongoing basis. So in the process of collecting this information, we have started to have some conversations around what are the options around how we could collect those data in a different way? Are there systems at the state that could be leveraged? Are there ways that our legislature could sort of think through a role for policy to kind of embed some of that data collection? Or is it just that we sort of continue to do that and call and collect that information school by school? I mean, local control is an important piece of the New Hampshire puzzle, particularly around education. And so it's another example, I think, of the way that our data infrastructure doesn't always keep up with the ability that we have as a state to pose really great questions like Donna just asked.
I want to return to the issue of mental health preparation and some things that the Institute on Disability at UNH and the Association of Infant Mental Health and credentialing in particular, and just to raise up a conversation in the chat about the cost of this credentialing and whether there are any grants or other ways to access this type of education and professional credential.
Yeah, that's a very real concern, and I'm glad that was brought up in the chat because, again, when we're talking about the wage levels of early educators, often the cost of gaining additional credentials can be prohibitive. And in particular, I think we really want to think through ways that any credentials that we're asking folks to gain are things that they can sort of build upon and take with them, or that are transferable, that make sense outside of a field if they decide not to stay, to really make sure that the asks are kind of both sensible and worthwhile from an educator's perspective. I mean, certainly the credentialing and sort of expertise building in these different areas is really important. It's just finding out ways to do that. And again, as a state, we have shown some creativity in ways of doing that around cost breaks for early educators or reimbursement for early educators to kind of enter specific credentialing pathways and to receive some funding support with that. But I think it has to be part of the question. If we're asking folks to build expertise, the question needs to be right alongside it. Who's going to pay for that and how?
Yeah, and I know IOD is very sensitive to this. Joanne says, so we're seeking support for the cost, including stipends. This is an elevated issue.
Yeah, thanks, Joanne.
Well, we're coming up, Carsey has a retreat these 2 days. So folks on the Carsey team will be needing to end 5 minutes early or so. But I wanted to put to Jess and Evan, how you would define success in 2 and 5 years, or early stage and mid stage of the consortium. And it certainly can be, quantitative indicators or that sort of thing, as well as any more qualitative or descriptive shifts you might like to see.
Evan, do you have thoughts?
Yeah, I guess I'll speak to kind of the more qualitative side of this. I mean, I would love to see, as a collaborative effort, I would love to see the consortium just continue to grow and, kind of involve more and more stakeholders. We've talked about the overlap of so many issues that are relevant to families and to educators and to communities. They aren't mutually exclusive. So to have this effort expand in a way that is reflexive to the needs of New Hampshire over time, knowing that those needs will likely change as communities change and New Hampshire's landscape changes. I think I would love to see that a lot of the things that are working well continue to work, and that also the consortium has been reflexive and is changing to whatever it needs to be reflexive to.
Mm-hmm. Yeah, I'll add on top of that, it's also kind of a bit of a squishy indicator, but I look at the group of attendees and I think, oh my gosh, I want to work with IOD on something. I want to work with BHI on something. And, just ways to sort of establish these connections between folks that are, like I said, doing this very cool, very forward-looking work in the field that we just haven't typically had an infrastructure for how best to collaborate. And I don't think we have all the answers, certainly, but this is a good place to start thinking about what that could look like and how we could really marry some efforts together for the greater good of the field. And so that feels really exciting to me. And I'm really thankful for folks showing up today and, hopefully getting an email from Evan and I shortly to talk about what some of those ways look like.
Absolutely. Meredith O'Shea, who's done a lot of work in this area, also from the New Hampshire Preschool Development Grant at UNH, also dropped a link for some funding opportunities, tuition coverage for ECE educators, and currently elementary school paraprofessionals. So check that one out. Thank you so much, Jess and Evan. I'm excited to see where this goes. Thank you for sharing your launch with the Carsey Policy Hour. And we'll have you back in future years to see how this is progressing and some of your findings and implications. I want to let folks know our next Carsey Policy Hour is on Wednesday, October 9th. Always the second Wednesday in the month. The topic is assessing New Hampshire's civic health during and after the COVID-19 pandemic and leading into the 2024 elections. This Carsey Policy Hour marks the release of the 2024 New Hampshire Civic Health Report. And like the ECE Research Consortium, like our research consortium, much of Carsey's work, this is a collaborative effort. And in October, we'll hear from Drs. Quijada Morvisi and Carrie Portree to overview the report's findings, discuss its implications, and we hope that will get wide coverage as well. Folks on the call, we know the date will be October 9th, but we're not sure of the time. 8 a.m. is ideal for many people as they transition to work, and all of you have shown up today, but we've heard it's challenging for others who might prefer lunchtime or later afternoon. So expect a 2-question survey in the next week on what time of day works best for you and which speakers and topics you'd like to hear. So thank you for showing up today. Hello to those of you who are watching this later. Many folks come to see the recording. And please do complete the survey when it comes to you. All right. Thank you so much, everyone. Have a great day, and we'll see you next month.